Everybody can be part of addressing this crisis. It's not just about the government, it's about everybody. Look, if you're not feeling well, stay home from work. If your kid's not feeling well, keep them home from school. That really can help. Watch out for your neighbors. If you don't need to be in a crowded subway, don't. Right? If you can go to work off hours, not during rush hour, that's great. If you can telecommute, that helps. But that doesn't mean stop participating in life or society. There's a balance that can be struck. And look, we have made a decision here in New York City. We're not canceling events. We're not telling people not to go out to dinner. I'm still going out around to show people you can go to a Chinese restaurant in Chinatown, you can go to a sport event, you can go all around your neighborhood, that's fine. And the more that everyday people exercise the common sense and sort of have their own sense of agency, the faster we will get through this. This is a moment with coronavirus that's really begging some much bigger questions. One of them, of course, is universal health care, which I believe in. I guarantee you, if we had a universal health care system, this crisis would be a lot less already, and we'd be getting out of it faster. But there's also this crucial question of paid sick days. We put 5 days per year paid sick days in place as law. A lot of the critics said we'd lose jobs, the economy would suffer. It's been the exact opposite. In fact, a lot of employers report healthier employees and employees who stick with them for a longer period of time in employment because they're happier and healthier. And I would urge any mayor anywhere, do it now, because boy, you want people to stay home if they're sick now. You don't want them feeling they have no choice.
The people who are most at risk for having bad outcomes from COVID-19 include individuals who have chronic underlying illnesses, including chronic lung disease, things such as emphysema, diabetes, cancer, heart disease, or who have an otherwise immunocompromised system, and who may be over the age of 50. You can also be at risk if you have behaviors that sometimes can affect your lungs, which include smoking or vaping. If someone isn't feeling well, the symptoms that we are most concerned about as potential COVID-19 include fever and a cough, or fever and shortness of breath. If someone has traveled to any country with ongoing transmission of COVID-19, or if someone has come in contact with someone who presented with COVID-19, then we want them to call their doctor and let them know, I now have these symptoms and I haven't gotten better in the last 24 to 48 hours. You know, one of the most common questions I get is how long can this virus live on surfaces? And the reality is that that's the wrong question. The question is, how can I best protect myself against COVID-19? And the best advice that we can give is wash your hands frequently, cover your mouth and your nose when you cough or you sneeze, and if you've got symptoms, don't go to work, don't go to school until you are better or you talk to your doctor. There's a place and a time for the use of masks. Everyday use of masks for people who have no symptoms is not what we are recommending. Masks are best left for when individuals are symptomatic and they are going to a healthcare provider so that they don't get other people sick. But otherwise, and most importantly, masks are reserved for people who are healthcare workers, because we need to make sure that our healthcare workers don't get sick with COVID-19.
The fact is, the people are the solution. You're the solution. We're going to get through this if we not only don't panic, but try to keep our lives as normal as possible. Just take those smart precautions and listen to the guidance and act on it, and that's how we get through this.